Hi everybody, my name is Jasmine Lockley and today I'll be talking about infant botulism and how to prevent it, who it affects, and being able to recognize it if it happens. So we're going to make this quick. Infant botulism is a serious illness that affects infants between the ages of 0 to 12 months. It is caused by a bacteria that grows inside of their bodies once it's ingested, and it can cause serious illness and possible death. The bacteria is toxic, and it affects their neurons and their muscle control. So who's most at risk? Infants. Um, Sometimes, or it's common at 6 months, these are where the kids are, using their motor skills or developing their motor skills, and they can put stuff in their mouths and touch things and do that. It affects boys and girls. And it's not just local or in the United States, it can occur worldwide. This disease has affected a lot of people for the last couple of decades, and yeah, in most cases, when the children swallow the spores, it can create the disease, and their underdeveloped digestive tract is what causes them to not be able to fight it as if they were a bigger child or an adult. Some symptoms that parents and caregivers may notice are constipation, um, weakness or trouble feeding, extreme tiredness, so lethargic, and floppy movements or poor head control and breathing trouble. And when these complications begin to happen, or these symptoms begin to happen, it's important to pay attention and to see a doctor as soon as possible. And also, quick action could reduce the time in the hospital. So this matters because, again, prevention reduces the risk, and recognizing the symptoms will allow you to react quickly. Because babies are so vulnerable in their first year, it's important to pay attention because they can't speak for themselves, so you have to advocate for them. You have to recognize what's different about them and what's going on so that you can help them. Transmission is important, knowing that it comes from environmental exposure. So touching dirt and then touching a pacifier and then giving it to the baby, that can possibly cause infant botulism. Leaving things out can cause it as well. It is not spread by person to person. So if you have another child, that child will not get sick by the baby or you. So it's not contagious like that. It's not like a cold or a flu. So spreading it isn't possible. Treatment and medical care. It's important to seek medical emergency or hospital care as soon as possible. Going to urgent care. Some babies may need breathing support because it causes irregular breathing or it's hard to breathe. Some babies may be intubated, but hopefully it doesn't get to that point because you'll be able to recognize the symptoms previously stated. There is treatment for it. So there is a medicine called Baby Big, and it helps to neutralize the toxin in the body of the baby so it can make the baby better. And most infants recover fully with early treatment. So the earlier you recognize the symptoms, the faster you'll be able to work effectively on the baby and treat it correctly and quickly. Thank you guys so much for listening to my presentation on infant botulism. I hope you learned something. Each one teach one. Make sure you tell a friend, tell a friend, tell a parent. Thank you.